originally from Southern California, from Los Angeles, and started out school at UC Santa Barbara, and then transferred to University of California, San Diego, and for my undergraduate. And at that time, I used to, well, in high school, I used to run cross country and track, and then in college, I used to ski race, and I love the skiing and love the snow and the outdoor sports, which is eventually what led me to Colorado. For podiatry school, I went to school in Miami, a school called Berg University in South Miami, and I had the pleasure of moving there 2 days before Hurricane Andrew, so I got to experience a little bit of wind early on. And what was good about Miami is you were able to deal with different types of skin conditions, and as they affected people on different types of skin, because there were patients of all races and color there, so you got to see a lot of different presentations. The patient population there, you had a patient population that had jobs and insurance, and you also had a lot of indigent patients that came in or floated in, and they were first brought over to the United States with a lot of untreated or never treated foot conditions that normally in our society would have been addressed earlier on. So you got to see a lot of pathology out there, which I think made that a good experience besides the hurricane. But I then did a surgical residency, one at Miami Heart Institute in Miami, Florida, and then did another surgical residency in Memphis, Tennessee at Baptist Rehabilitation in Germantown in Memphis. And then I ended up buying a practice from a doctor here in Colorado Springs that was moving to Durango. So I was looking to come back to Colorado. I had done some externships in Denver back in about 1995, and so I moved here and began a practice in 1998, and I've been here in the Springs ever since. In Miami, a lot of my training was done, we worked very closely with the Wound Care Center and with the Vascular Lab. So I perform a lot of wound care in my office, and a big part of my practice is not just seeing sports injuries, but also seeing a lot of diabetic patients or patients with peripheral vascular problems, and helping them to protect their feet so that way they can spend the rest of their life with both of their limbs and not end up with amputation. So a lot of my practice involves diabetic foot care, foot screenings, if patients do have wounds, looking at the underlying cause of the wound, getting the wound to heal as quickly as possible, and then addressing the underlying cause to prevent reoccurrence. So you can help the patient to prevent amputations and have them have a better quality of life. But I feel very comfortable with the wound care. It's one of the favorite parts of my practice. You get to know the patients very well, and that's one of the things that I like to do, and because it's rewarding to see a patient heal and get their life back and get back on their feet and improve the quality of their life that way.